Now you'll notice that we use the term cesarean birth versus cesarean section. And that's because we believe that a birth is a birth is a birth. Regardless of whether your baby is coming into the world through your vagina or through your stomach via a surgery, it's still a birth. And so using that word to describe the process of a cesarean is a much more gentle and supportive and inclusive way to look at the experience. Now that that's out of the way, let's talk about the reasons why a cesarean birth might be the experience that you have. Cesareans can be planned, and they can be planned for a couple of different reasons. One reason might be because your baby is in a breech position, meaning that your baby's head is not head down facing the cervix. Having twins is another reason why a cesarean birth might be offered to you. Depending on your provider's skill level and the complexity of how your twins are positioned in utero, whether they have a single amniotic sac or are sharing one amniotic sac, these factors are going to be important to decide whether or not your babies can be born via a vaginal birth or would be safer being born through a cesarean birth. Placenta previa, which is when the placenta, which is a nutrient-rich organ that's inside the uterus that connects to your baby's umbilical cord, that placenta grows over the cervix. The cervix is the opening of the uterus through which your baby has to pass through in order to be birthed. When the placenta is covering the cervix, it means that there's no way for your baby to pass through that opening without there being a dangerous amount of bleeding. The last reason why a cesarean birth might be planned is because you are choosing to have one. Now, you might be asking yourself, why would someone choose to have a cesarean birth? There are a number of reasons for that. What I've seen over the years is that the choice of having a cesarean birth sometimes has a lot to do with anxiety of not wanting to wait and go into labor without assistance. Another reason might be because of sexual trauma or physical trauma. People that don't feel very safe in their bodies find the idea of having a vaginal birth very activating. All of the activity, eyes, engagement in that area being their vulva and vagina, might not be a safe experience or a safe feeling for them. And so having their baby be born through a cesarean feels more controlled and feels safer and keeps their care providers out of their genital area, which makes sense if the genital area is a place of discomfort. So if you are choosing to have a cesarean birth, I really want to take a moment and offer you some support around your decision. And more than likely, you probably will receive a lot of pushback around this, maybe even from your care provider, especially if you've had a very healthy pregnancy. Everything is lining up to show that you should have no trouble having a successful vaginal birth. Even if that is the case, it's so important to trust your own intuition and to do what's going to feel the most comfortable for you, especially if you're someone that has had a lot of trauma in their life, or at a very base level is someone who really doesn't want to experience a lot of pain or discomfort for whatever reason that might be. I hope that gives you some confidence and some comfort to really lean in and feel empowered about your decision to choose a cesarean birth if that's what feels right for you. Cesarean births can also be unplanned, and some reasons why that would happen could be because of something called decelerations or non-reassuring fetal heart tones. Now, a deceleration is when you have a contraction, your baby's heart rate goes down. As the contraction ends, your baby's heart rate stays down for a little longer than feels comfortable. Now, decelerations are actually a normal part of labor, especially in the final stage as your baby is being pushed because there's so much pressure being added from the uterus and from your body as you're squeezing your baby out. However, in the earlier parts of labor, especially in early to active labor, a lot of decelerations without being able to figure out why they're happening could indicate the need for a cesarean birth. Oftentimes, the language that you might hear from your care provider is that we feel that your baby would be safer outside of your body than inside of your body. Now, keep in mind, when decelerations are happening, your care providers might all come into your room, especially if you're in a hospital, all at the same time. They might break down the bed, shift you around in a lot of different positions. And the reason why they're doing that is to try and figure out what position they could get your body into to help the baby get better on the monitor or to get their heartbeat back where they need it to be. Trying to intervene around decelerations can actually feel like a very scary experience if you've never been a part of that before. And oftentimes what happens is they figure out how to fix the deceleration issue, and then you're told everything's fine, go back to laboring, baby looks great, and we'll just keep checking on you. And I want to mention that because that change in energy and change in environment can feel really scary. And sometimes when that happens, it can be hard to get yourself back into a good headspace to continue laboring. If that does happen to you, remember, if your care provider gives you the green light and says, keep going, you're doing great, everything looks good, you truly can believe that and try and find your way back to that just right state. And some of the tools that can help you with that would be the sensory tools that we talk about in the module about sensory integration and pregnancy. But back to decels and why they can end in a cesarean birth is when there's too many of them, a lot of different positions are tried to get the baby to get back to that heart rate that we're looking for or that your care provider is looking for, and it doesn't happen. And as a result of not being able to get back to that heart rate that would be more comfortable, you have to move forward with a cesarean birth. Failure to progress is another reason why an unplanned cesarean can happen. And failure to progress means after a number of hours of labor, there has been no progress with the labor. And that can look like your baby not coming further down in the pelvis, so not descending in pelvic station. That can mean that your cervix doesn't continue to dilate sufficiently or efface sufficiently. After a number of hours and a number of different interventions being added to help support that process. Usually failure to progress happens when there hasn't been any significant cervical change or pelvic station change in around 4 to 6 and sometimes up to 12 hours. CPD, also known as cephalic pelvic disproportion, is the idea that your baby's head is bigger than your pelvis can accommodate. This diagnosis is typically given in retrospect after your birth, once there's time to actually measure the circumference of your baby's head and understand why there might have been this mismatch in relationship to your pelvis. If CPD is given to you as a reason for a planned cesarean, it's definitely worth getting a second opinion because oftentimes it can be inaccurate. Cesarean births can also happen as a result of an emergency. Decelerations, which I just talked about, can be categorized as an emergent issue and a reason to accelerate forward with a cesarean birth. Placental abruption, which means the placenta is coming away from the wall of your uterus before your baby is born. That is a problem because the placenta is only supposed to be born or delivered 30 minutes after your baby is born. So if the placenta starts to detach any earlier than that, it's a major problem and can create a lot of bleeding. And that is a reason for an emergency cesarean birth. Umbilical prolapse is when the umbilical cord of your baby falls below your baby's head. And that's going to happen when your baby is still pretty high in the pelvis and hasn't engaged low enough in order for that umbilical cord to remain higher up above their body. Lastly, there's uterine rupture, and that's when the actual walls of your uterus rupture. What actually happens during a cesarean birth? A cesarean birth is a surgery, so it's going to take place in an operating room. Now, depending on why your cesarean birth is happening, if it's planned or if it's unplanned or if it's an emergency, will impact how you make your way to the operating room. If it's planned, that process will be fairly fluid and easeful. You'll know what time you're coming into the hospital. You'll go through all of the triaging steps, meaning the steps where you are looked at holistically as a patient to make sure everything is okay before moving forward with the surgery. And the process will have a pretty gentle cadence from step to step. If your cesarean birth is unplanned and you've already started or attempted to have a vaginal birth, the process might feel a little disorientating because more than likely you'll be really tired, you would have labored for a number of hours, and might not be able to take in every single step that's going to happen to support the cesarean birth process. The same very much applies to the emergency scenario of having a cesarean birth because that emergency scenario will be very, very fast. And there's a strong possibility with an emergency cesarean birth that you might need to actually be put under general anesthesia, meaning that you would be unconscious in order for your care providers to get in and take care of the issue that's taking place. So, keeping that in mind, let's talk about the actual surgical process. Before the birth begins, if your cesarean birth is planned, I really suggest that you shave, wax, or whatever hair removal process that you feel comfortable doing, that you do that in the area right below your bikini line. And the reason for that is the area where the low transverse incision will be made to start the process of bringing your baby into the world. And if you don't shave, the care providers will shave that area for you. So do whatever process actually feels most comfortable for you. Now, let's go back to the beginning. Before the birth begins, your OBGYN and an anesthesiologist will come into your room and explain what the procedure is going to entail and get you to consent to the procedure. This is going to happen regardless of whether the cesarean birth is planned, unplanned, or an emergency. Your consent will always be needed. From there, you will put on PPE, which will help keep you and the OR, the operating room, sterile and safe. Your partner, if you have one, or your support person or chosen family, whoever is able to come into the room with you, which you should be allowed at least one person, they will also put on PPE. From there, you'll go into the operating room. The operating room is often very, very cold. That's something to remember as well. And that cold temperature is to help to decrease the potential of bacteria and germs spreading in the room. Once you're in the operating room, the first thing that will happen is you will get an epidural. The epidural is to manage your pain and keep you comfortable through the birth process. The epidural is given to you through an IV catheter, which will be placed in your back. Once that IV catheter is placed, the medication will start to flow through continuously throughout the entire birthing process. The epidural is going to numb you from the top of your stomach all the way down to your feet. The epidural will make sure that what you will feel is pressure, not pain. And your OBGYN and your anesthesiologist will kind of poke and prod you to make sure that the epidural is really working before doing anything else. From there, the actual process of the birth will begin. Now, believe it or not, cesarean births are actually pretty quick. From the moment of the first incision to the actual birth of your baby is around 5 to 10 minutes. So it's pretty quick. And then from there, after your baby is born, to you being all sewn up and ready to leave the operating room is about 45 minutes. Now, what happens when the actual birthing process starts? The first thing that will happen is your OBGYN will clean the area that they're going to be operating on. And then your OBGYN will make an incision into your abdominal wall. They will clamp that incision open. They will then irrigate that area to find your uterine muscle. That uterine muscle will then be cut, followed by the actual uterus being cut. Once the uterus is cut open, The uterus will then be clamped. Suctioning will happen to make sure that they can see exactly what's going on. And then your baby will be located. And then the care provider will gently press down on your abdomen. And when that pressing down happens, it can feel like a lot of pressure. And you might even feel your body kind of seesaw to the left and the right. You also might even find that you might feel nauseous or a little uneasy when that big lever of pressure happens. But that pressure is to help push your baby down and bring your baby out of a very small incision, quite similar to the type of gateway that your vagina would have provided if your baby was to be born vaginally. Your baby will be pulled out of your uterus, shown to you, and maybe if you have a clear drape, which is a possibility at some hospitals, you might be able to see the process happen. And then your baby will be taken to a warmer. That's a great time if you have a partner or a support person in the room to have them move away from you and actually go to the warmer to be with the baby so the baby can hear their voice or have their energy in those first few moments after they're born. From there, your provider will then quickly start to sew you up. Now, keep in mind, things that you might smell or hear when that process is happening are the smell of burning skin or burning flesh, because one of the tools that are used to close up incisions is a cauterizing tool that uses heat to seal the skin. It's a really weird smell, so I always like to talk about it so you don't feel like anything is wrong if you smell that smell in the room. Sometimes after your baby is born, your providers, while they're sewing you up, can move into a little bit more of a casual energy, and there can be a lot of discussion that might not be related to your actual birth. If that's something you'd like to avoid, it's definitely something that you can write into your birth preferences to ask for there to be very little conversation other than what is absolutely necessary to make sure that your birth is successful. Once you're completely stitched up and closed, from there, you and your baby will go to recovery. That's where you'll be able to hold your baby for the first time and potentially even have your first breastfeed or body feed. Now, at some hospitals, it is possible to have skin-to-skin time in the actual operating room, but that's something that you'll have to talk to your care provider about and negotiate into your birthing preferences. Then, right after your baby is born, before your OBGYN starts to sew and mend your body, your placenta will be surgically removed from the uterus in order to complete the process of birth. And once your placenta is removed from your uterus, that's when your body really knows that you're no longer pregnant. And that's when your body starts to increase the volume of milk in your breasts, which I go into more detail about in our postpartum class in Feeding Basics. Now, what I can tell you is every cesarean birth is going to be different. But what I just shared with you are the general steps and the general processes that you can expect in a cesarean birth. I also want to share some really helpful calming and centering tools that you can bring into a cesarean birth in order to make it more gentle and more supportive. Now, when I was describing the actual process, I talked about a clear drape. A clear drape can be a helpful thing to ask for if your hospital has it available. What a clear drape does is that you're actually able to see that first moment when your baby is born and lifted out of your belly. For some people, that's going to be something that's really going to help you feel more connected to the process. For other people, you might feel like, ugh, I don't really want to see that. And that totally makes sense. But I really want you to know that that option is available. And really the focus here is how can we create more connection points for you to the actual birth of your baby. Another option is to ask for the birth to be family-centered or to be gentle. Different hospitals and different OBGYNs might have more awareness or less awareness of this process. But essentially what it means is to try and make the actual movements of the birth and the release of your baby from your uterus as slow and as smooth as possible. There's more information about gentle cesareans and family-centered cesareans in the guide that goes along with this module of the class. Another thing that you can bring into the actual operating room with you that could be really helpful are some sensory tools. One of them could be a mouth guard. And a mouth guard, you might be asking, why would I need that if I'm actually not going to be pushing out my baby? Well, when you're going through a procedure like a cesarean birth, there can be a lot of clenching and gripping of the mouth, especially because it's one of the few places on your body that you're going to have feedback and you're going to have sensation. And what I've noticed over the years actually is when my clients were having their babies born out of their bellies, especially during the actual birthing process of pushing that leverage that I was talking about, there was this automatic gripping in the mouth and tension in the mouth. And so to help support that happening, the mouth guard can help you have more supportive oral feedback and create less tension and more softness if you do happen to clench or tense your face or tense the upper part of your body during that part of the birth process. Aromatherapy is another wonderful thing that you can bring into the OR. The best way for that to come in would be to have a tissue with a little bit of oil placed on it for you to breathe in through the nose. Another option might be to have a cotton ball placed in the same area, or your partner or support person could rub a little bit of aromatherapy on their hands and just gently wave them over your face as the procedure is going on. I often did that many times in the operating room over the years. Something that can be really helpful for your partner or your chosen support person to do for you in the operating room is to do a little bit of facial massage. Two really helpful strokes can be taking their two fingers, index, middle finger, and just stroking with gentle downward pressure over your eyebrows consistently, especially during the actual birthing part of the procedure. Another option would be to have them take their fingers and just gently rub at your jaw in a circular motion, or to drag down on the side of your jaw. And again, this is to help support and prevent or ease any clenching that's happening throughout the birthing process. Another centering tool that isn't exactly massage, but it does involve your partner or support person using their hands would be to have them take their hand and apply it to your chest, providing firm and consistent pressure. That also is a way to help you stay connected to your body as the birth is happening, especially because you're not going to have a lot of sensation or any sensation at all really from the stomach down to your legs. If you're very sensitive to sound, a great sensory tool to bring in would be noise canceling headphones to help just drown out any sound, any odd noises. That could be a really helpful thing as well. If you wanted to use noise canceling headphones, keep in mind that you'd have to really talk to your OBGYN about that first, because they're going to want to be able to talk to you and ask you certain things as they're moving through the birthing process. So there might be a section of the birthing process where you could use your headphones, but maybe not at the very beginning or at the very end. So definitely talk that through with your OBGYN if that's something that you're wanting to bring in. On the other end of the spectrum, you might want sound or music. A lot of ORs actually have access to speaker systems where you can plug in your phone or be able to play music in one way or another. So that's something to definitely check in about as well. Alternatively, you could just play music in your headphones or play music on your phone and have your phone nearby your face. Whatever tools you want to bring in to feel more comfortable during your cesarean birth, make sure that you incorporate them into your birth preferences and you clarify your needs with your care provider and talk through these options ahead of time so that you can make sure that you have what you need to have a birth that feels supported and empowered.